Good afternoon, everybody. The Chair of the Presidential Task Force on COVID-19, honorable ministers here present, the National Coordinator, permanent secretaries, directors. As of 10th of August 2020, we have recorded 46,577 cases from 317,496 samples tested so far, while 33,186 persons have been treated and discharged. Sadly, 945 persons have been lost to COVID-19 infection, which has now been identified in 549 of our 774 local government areas. Half of all cases in Nigeria so far, over half, are concentrated in 20 local government areas, which could offer the attractive option of targeted attention to focus on case finding and isolation and treatment. The figures show that Nigeria is also sadly approaching the symbolic 1,000 number of fatalities, a grim reality that should be a wake-up call to all of us. Many more Nigerians today would have personally known a person who succumbed to COVID-19. And so I ask that we remind ourselves that COVID-19 is still with us and will be with us for a while. Until there is a vaccine, the only options we have to protect ourselves are still the non-pharmaceutical measures that are proven to be cheap and effective, such as the appropriate use of face masks, physical distancing, and avoiding crowds. If we do not adhere, there will be regrets. And the urgency is accentuated by the need to prepare for societal changes that will arise as the economy reopens with increased transportation, trade, human interaction, and even the option and possibility of reopened air travel internationally. We must make an effort to balance the benefits of a reactivated economy and not lose the gains made so far. Since Friday, the 7th of August 2020, we joined the rest of the world to commemorate what is known as the World Mask Week, the aim of which is to reinforce the importance of wearing masks to reduce the risk of spread of COVID-19 in the absence of a vaccine. Our focus is still to reduce fatality to less than 1%, not only with preventive measures, but also with a strategy that encourages citizens to report early for treatment and for hospitals to attend to all patients in distress. Most importantly, to be able to provide oxygen treatment. The main COVID-19 symptoms include breathlessness, which responds well to oxygen supplementation as a first measure. We are turning our preference, therefore, to gadgets that provide oxygen, like oxygen generators, to be in many facilities, including general hospitals and larger primary healthcare centers. Solar-powered aggregates, where available, will be prioritized. federal health institutions with oxygen plants should activate them as a matter of priority and ensure they can deliver to their A&E departments. The other measure is the activation of ambulance service to move patients to treatment centers. This strategy worked well in Kano, and all states should prepare to set up the system. The Federal Ministry of Health will provide guidance and support and training. The National Council on Health, which is the highest policy-making body on matters relating to health in Nigeria, held a virtual emergency meeting on Thursday, the 6th of August, 2020, during which the revised guidelines for the administration, disbursement, and monitoring of the Basic Healthcare Provision Fund, also called BHCPF Guidelines 2020, was approved. With this document, implementation of the Basic Healthcare Provision Fund, which was suspended in January to correct anomalies in the 2018 operation plan, has now resumed, and the process of disbursing fund has also started right on time to support much needed state efforts in their COVID-19 response. The new BHCPF has much better country ownership structure and offers a much improved benefit package and a more robust fiduciary control for transparency and accountability. Development partners are invited to support the new revitalized plan in whatever manner they desire. We have made preparation to accommodate the varying programs and interests of our partners. The Ministry of Health is available to discuss and address the concerns and wishes of potential donors and users. The continuity of normal health services, capacity building of health workers, and their protection with PPEs are the most critical activities that we will wish to see secured. Resilient health systems ensure that basic healthcare provision fund services continue to reach PHC health facilities, which can be both public and private, and referral cases are sent to secondary healthcare facilities. It is critical in our present COVID-19 pandemic challenge to use the opportunity to strengthen our health systems. I also call on state, local government authorities, and healthcare workers to ensure the most rational and judicious use is made of all commodities provided. The National Council on Health also approved the establishment of the National Emergency Medical Service and Ambulance System, NEMSAS, an innovative system to pool the assets of public and private sector ambulances and hospitals, and also to raise funds to augment government seed money, to work with states to provide emergency medical care and patient transportation to all citizens whenever and wherever it is required, and irrespective of immediate or potential ability to pay. It will be possible to considerably reduce COVID-19 mortality and also reduce maternal and child mortality and post-crash mortality with a functional emergency medical service and ambulance system that can rely on the combined assets and efforts of private and public sector hospitals. It was my pleasure to receive the new leadership of the Nigeria Medical Association, headed by Professor Uja, on Friday, the 7th of August. And the visit offers the opportunity to re-engage the association for collaboration in addressing challenges in the health sector. We shall continue to value the input of our colleagues and also of all our frontline health workers as we move forward. I thank you all for your attention.